Bismillahirrahmanirrahim. Okay, guys, so we know that the CTG guideline got updated, the intrapartum fetal monitoring of NICE got updated in November 2025, and now I'm going to, re explain it with the updates. Okay, so you just have to, I'm gonna tell you what to do for the exam. Okay, so today we are only going to do the amber features of CTG, which make the trace suspicious if one amber is present. We know that as far as amber is concerned, when there is one amber feature, the CTG trace is suspicious, and when there are two amber features, the CTG trace is pathological. So, the first thing that you should know is what to do in a suspicious trace, and then we are going to deal with its management, and then I'm going to tell you the detail of amber CTG. So, whenever the CTG trace is suspicious, what does that mean? Can anyone tell me what does that mean that the trace is suspicious? It means that there is one amber feature. That's it. One amber feature means that the trace is suspicious. Now, what are you going to do? You are going to look for the concerning risk factors. What are the concerning risk factors mentioned in the guidelines? They can be anyone, but the most important ones are slow progress of labor, sepsis, suspicion of sepsis, and meconium. Okay? So these three things. So you're going to look for these three things. If they are present, then your management will be different. If these risk factors are not present, then you are going to carry out these concern risk factors are not present. We have here. You're going to carry out a full risk assessment and document it in your notes, in which the antenatal and the intrapartum risk. Just do a whole assessment. Look at the whole clinical picture. Now you're going to ask yourselves two questions. What are the two questions you're going to ask yourselves? Since there are no concerning factors, these are not present, so we are in not that sort of a dangerous situation. You're going to ask yourselves whether there are any accelerations in the trace, because if the accelerations are present, then this means that fetal hypoxia is very unlikely, so still you are not in that much danger. And then you're going to ask yourselves, what was the trace before this suspicious? Was it white? Was it red? What was the situation before? If the CTG trace was normal and it suddenly turned suspicious, then ask yourself, why has it suddenly turned suspicious? Okay? So these are the two questions that you're going to ask yourselves. If the acceleration is positive, then fetal acidosis is unlikely. So look for the acceleration in that suspicious trace. Okay. Then if the previous trace was normal or not. If it was normal, then think what could be the possible underlying risk factors. Quickly, make an assessment. Okay. Now, after asking yourselves these two questions, you're going to do the conservative measures. Now, every MBBS student knows what are the conservative measures. Can someone tell me, please? Because we still have to be very careful with these. The first one is the maternal position. So she should not lie supine, okay, because it causes the aortic cavity compression and disturbs the fetal blood flow. She should be mobilized. Okay, a very important point. You should know this guideline word to word. Okay, this is the basics of obstetrics, so you should know it. That's why I'm going to elaborate each and every point. Okay. So what they say is that in view of maternal position, you are not supposed to ask her to be left lateral. You are just supposed to mobilize her and ask her not to be supine. Okay? She shouldn't be supine and she should be mobilized. There is no mention of asking her to be left lateral. Okay? Now, in this respect. Next is hypotension. So when are you going to give IV fluids? You're not supposed to give IV fluids just on the basis of suspicious trace. Only give an IV fluid when you think that the mother is dehydrated or there is signs of sepsis. Only in these two conditions you're going to start the fluids. Okay. The third scenario is the hypertension due to anesthesia? you're topping up an epidural and the patient becomes, suddenly becomes hypotensive, then in that case, what you're going to do is you're going to give IV fluids. You're going to ask her to be left lateral, and you're going to call the anesthetist for a review. Okay, so these three things you're going to do. If the hypotension is because of the epidural, so please make sure that you know the reason of hypotension. Hypotension due to epidural is going to be a different scenario. Okay, now if there are increased contractions, this is also an amber criteria that 5 or more contractions in 10 minutes, then you're going to stop the syntocinon. You are going to go for terbutaline 0.25 mg subcut. So please remember that no IV fluids in this scenario also. The guideline has been updated. Okay, a few words here, a few words there. Now we're done with the suspicious trace management. Now, how are you going to manage the trace? I have told you. How are you going to classify? How are you going to know that this is suspicious? For that, you should be familiarized with the amber features of the CTG. Okay, and these are the amber features. I have written them together from the guideline. Okay, the first point is the contractions. When there are 5 or more contractions in 10 minutes, or there's hypertonus, this is amber. This is not red. There is no red for contractions. You're not going to let it go beyond that. So just as the contractions become 5 or more, you're gonna, suddenly do an assessment and suddenly get alarmed that this is suspicious. So for this, you're going to do a full risk assessment, and you have to take an action to reduce the frequency of contractions and explain to the woman what is happening and make sure that there's pain relief. Okay, these things you have to do. Now the second feature for that is a fetal heart rate. So very important point that many residents ignore is that, let me just explain a scenario. For example, there's a patient who is in labor, and her fetal heart rate is 120, and suddenly it becomes 150. So it increases by 20 beats per minute. What are you going to do? Option A, you're not going to do anything because this is within the normal range of heart rate, that is from 110 to 160. So it's normal, it's a good thing. Option number 2, you're not going to do anything. You're not even going to think. Option number 3, this is amber feature. You are going to note that down, that this is an amber feature, and get alarmed a bit. So this is an amber feature. So this is the tricky part, that even though the heart rate is within the white feature of the CTG, but increase in heart rate from baseline of 20 beats per minute out of nowhere is an amber feature. So please, spend some time on this point and try to understand it, because many students get to ignore it. Okay. Fetal heart rate of 100 to 109 is very easy to pick. It will be right in front of you on the CTG monitor, and you will say that this is an amber feature. Or a change in baseline of 20 or more. If this happens in second stage, when the patient is fully dilated, this will be a red feature. But if it's happening before the second stage, then this is an amber feature. Or you are unable to determine the baseline. For example, there are a lot of accelerations, and you're very happy that the variable, suddenly a lot of accelerations, and then the variable, and then so in this portion you're unable to determine the baseline. So even though the heart rate is within the normal limits, it's not in the 109 to 100, it's in the 110 to 150 demarcation, but still you're not able to determine the baseline. This is going to be an amber feature. Okay, a bit tricky, but you'll get used to it if you revise it. Okay, so these are the 3 points in the heart rate, which are the features of the amber portion of the NICE guidelines. Okay, so I hope you have understood it until now. If anyone has a question, you can ask. Okay, now we have the variability. For variability, if it's less than 5 for 30 to 50 minutes, or if it's more than 25 for up to 10 minutes. Okay, so a variability of less than 5, cycles of low variability can be because of sleep. But if it's between 30 to 50, if variability is less than 5 for 20 minutes, that's not a concern. If it's less than 5 for up to 25 minutes, but if it's less than 5 from 30 to 50 minutes, in the 30 to 50 demarcation, then in this case, what is going to happen? You're going to classify it as amber. Or if the variability is more than 25, then this is going to be amber if it's up to 10 minutes. If it's more than 10 minutes, then it becomes red. So I'm sorry guys, but you'll have to memorize this. I know it's typical, but it will become easy if you revise it again and again. That variability of less than 5 for 30 to 50 minutes and variability of more than 25 for up to 10 minutes. Now we have the portion that has been updated. So there are no longer late decelerations in amber. Late decelerations are now a red feature regardless of their duration. Late decelerations are there, it is red. So I have mentioned decelerations with concerning characteristics. So can anyone tell me what are the concerning characteristics of deceleration? What are the concerning characteristics? Okay. So the concerning characteristics are, let me explain them by drawing them. Okay, wait. The concerning characteristics of a D cell are basically there's a D cell and it returns to the baseline sharply. So this is shouldering, okay? So a rapid return to baseline is a good thing, which means that shouldering, please look at the images on the search engine for shouldering and you will, your eyes will be able to recognize them. Develop your eye for shouldering because it's a good thing, okay? But loss of shouldering, what is the meaning of loss of shouldering? That the D cell, just a second, guys, I don't have a board, I'm sorry. That the deceleration is not returning to baseline. For example, there's a dip. Okay, wait, this is the baseline. There's a dip, and the dip is continuing. Or if it's returning, it is returning very slowly. So there is no shouldering. Over here, there's a proper sharp shoulder formation. Over here, there's no shouldering. So this feature is a concerning characteristic. This means that the fetal hypoxia is becoming severe, and okay. So the fetal system is not able to compensate for the hypoxia. The compensatory mechanisms are failing. Okay. So, loss of shouldering, which can also be called as failure of the D cell to return to the baseline or a slow return to baseline, is a concerning characteristic. Next part is a deceleration that lasts for more than a minute. Of course, that's a lot of bradycardia. So, a D cell is not mostly going to be bradycardic, it's just, a drop by 20 in the heart rate. So, for more than 1 minute. And then the next point is a W formation. Okay, this also you guys will have to look at the images and decrease variability in deceleration. Okay, so now in the deceleration part is the variability is decreased. This is also concerning feature. So because all these cells are not bad, early these cells are normal, they're physiological. So if a D cell is there, you have to, try to look at it and comment on it. Next time you're in the labor room, whenever there's a deceleration, try to comment on it, whether there's shouldering, how is the variability in the deceleration, how is it returning to the baseline, whether there's a W formation, how long is a D cell. This is a very important point. So if all these four things, any of these four things is there, it's a concerning characteristic. So to be in the amber criteria, there is only variable D cell, and that variable D cell should have a concerning characteristic. Okay. So I'm sorry, okay. There is going to be a variable D cell, and this variable D cell must have a concerning characteristic. I'm writing it as CC. Okay, and then we classify it as repetitive variable D cell. I'm writing it as RVD, or non-repetitive variable D cell. I'm sorry, guys, we'll have to cram this. So if the variable D cell is repetitive, then it should be less than 30 minutes. Okay, and if it's non-repetitive, then it should be more than 30 minutes. So this is the whole point, okay, for the deceleration, amber criteria, the deceleration should be number one, a variable one. The deceleration should be a variable. And number two, the deceleration should have any of the concerning characteristics. These four concerning characteristics, any one of these should be there. And number three, if it's repetitive, then if it's less than 30 minutes, it's going to be amber. So if this automatically means that if it's more than 30 minutes, it's going to be red. If it's non-repetitive, then more than 30 minutes is going to be amber. So which this means that a non-repetitive variable deceleration for up to 30 minutes is white. But if it's more than 30 minutes, then it's amber. Okay. So now you know about the amber CTG features. Any one of these, the CTG trace will become suspicious. And I've also told you that if the CTG trace becomes suspicious, then how are you going to manage it? Thank you, guys.